Good morning, everyone. It's a great pleasure to present an innovative European project that connects three universities, including University of Crete, in sleep medicine and in digital healthcare education. Let me start by giving you some information to explain the rationale of the program. We all know that sleep is a fundamental element of human biology and a requirement for life. Based on its effect on cardiovascular health and general overall health, sleep duration was selected from the American Heart Association as a crucial component for cardiovascular health, along with nutrition, physical activity, blood sugar, BMI, blood lipids, blood pressure, and nicotine avoidance. Also, lifestyle medicine highlights the crucial role of sleep in overall well-being, comparable with other elements like physical activity, stress management, and nutrition. Therefore, sleep medicine offers diagnosis, treatment, and management of sleep disorder, improving both sleep and overall health quality. Among the most prevalent sleep disorders are sleep-related breathing disorders such as obstructive sleep apnea, which affects around 1 billion people worldwide, inadequate sleep, which is widespread around the world, and insomnia, shift work disorders that are highly prevalent with important health effects and economic implications. However, obstructive sleep apnea, it seems to be like an isolated problem in many healthcare professionals. However, in reality, it's just the tip of the iceberg. It's not only snoring, fatigue, and sleepiness, but beneath the tip of the iceberg, we can see many adverse outcomes like cardiometabolic comorbidities that all of them increase the economic burden of the disease. And yet, in general, all these sleep disorders like obstructive sleep apnea are underdiagnosed by healthcare professionals. We all know the benefits of treatment, especially in sleep-related quality of life, in decreasing motor vehicle crashes, in declining blood pressure, and in excessive daytime sleepiness, and potential benefits in cardiovascular and cardiometabolic diseases. Therefore, early identification, screening, diagnosis, and treatment is really essential to prevent long-term outcomes and also to have an overall better quality of life. And this is the modern healthcare that includes telemedicine. That telemedicine now contributes substantially in all fields of sleep medicine, screening, diagnostic, and treatment, and of course, follow-up of the patients. And this is the future. Now we have new diagnostic tools, new technologies that all help us in all the procedures of diagnosis, analysis of the sleep data, and follow-up of the patients, and to see how treatment goes with the participations of the patients in their own health. In this context, the Reykjavik University leads the Sleep Revolution project, an innovative project that have many digital tools. So it's trying to develop new diagnostic standards to transform current diagnostic methods for sleep disorder breathing. Also tries to bring advanced sleep diagnostics from hospital into patients' home. Develop different personalized treatment options for sleep disorder breathing patients, and also to promote participatory healthcare with technological solutions. Therefore, in our project, the new European project that we're representing, the eSleep D-Health, is trying to link all the technology that is available from the Sleep Revolution project in order to present new technologies for many patients. The problem is that we have many patients that they have low digital literacy and cannot benefit from the digital revolution. And also, sometimes we don't have digital sleep revolution followed by comprehensive digital medicine education, especially in the students that we have now. Therefore, this is the aim of the project, try to provide the students with all the new technology and all new digital literacy. We have 5 project partners, University of Split, Reykjavik, and University of Crete, and this is a collaborative project bringing academia, healthcare, and the industry that focuses on addressing sleep medicine and digital health challenges. Also, it's an innovative educational course for students. It is the first time that it's done, focusing on healthcare innovations that combines academic study with hands-on innovation in sleep medicine and digital health. So we developed a new online training program for students, we didn't have only medical students, but also from other study programs like psychology and technical students. All students focused on interactive, innovative, and practical learning with mentors and experts in the fields. And also there was an international collaboration in multidisciplinary teams solving currently emerging real-life problems of digitally vulnerable groups. This is the journey that we followed. We had two phases. The phase one was to develop and design the curriculum for the students, and the phase two that we are now conducting is the learning expeditions in Crete and in Split. The journey started with the first staff training on design and thinking and open pedagogy. So all the mentors, all the teachers were gathered in Croatia in 2023. Also, we had the participation of the students, and in a really good connection and atmosphere, we tried to develop the curriculum for the SLEEP students. We also developed a slogan in order to promote students' participation. So the slogan, as you can see, is the wake up, it's time for sleep, join a transformative course that's shaping the future of healthcare, and take the first step toward becoming Europe's sleep expert of tomorrow. Then the program followed a second staff training in Iceland last year. We also have teachers, we have students that helped us. And all of this, as you can see, joined the connection of this program in a more friendly environment. And also we had the opportunity to finalize the educational materials for the curriculum. We had video recordings and many videos that promoted more the program to the students. So what we did is that we developed and finalized the learning materials, and we used open pedagogy. That means that we emphasized on collaborative learning where students actively created and share knowledge with peers and mentors. And we have three modules: the sleep medicine, the digital health, and the entrepreneurship. And all of these were accessible to the students with videos, written materials, quizzes, and teamwork assignments. Here you can see the platform where students had access, and this is how the material was organized with videos, assignments, written material, and many quizzes. Then we are in the second phase now, which is the social innovation incubator. That means that students have the opportunity to apply academic knowledge to practical challenges within incubator, and also they had the opportunity to solve real-world case studies in sleep medicine using the design thinking method. They also collaborated in international and interdisciplinary teams. So now we are in the final phase, the learning expedition. The one is being conducted now in Crete. So in 5 days, students have the opportunity to develop a relationship with other students and also learn more and have more practical workshops. So what did motivate the students to participate in this program? There were many advantages. They had the opportunity to travel and learn and experience hands-on innovation while exploring Crete now and Split in the future. Also, they built experience in sleep medicine, digital health, and entrepreneurship. So they make the connections that matter, build friendships, networks, and memories that will last a lifetime. They worked on a real-world healthcare challenges with practical workshops and created solutions that make a difference, and gained essential skills and prepared for the careers of tomorrow. This is the plan and the structure of the program. As you can see, the three first, the sleep medicine, the digital health, and the entrepreneurship module are all online, and they are finalized in this time. Now we have the first learning expedition in Crete. Then we'll follow a summer in the cloud where students will work together remotely. And then we have the second learning expedition in Split. Here we have now, in these days, the first learning expedition. So all the students had the opportunity to learn and apply design thinking methodologies to develop creative, user-centered solutions. They worked all together, as you can see. We have practical workshops with real patients. They had the opportunity to interview them, to present the challenges, and to see how treatment adherence could be improved in these patients. Now, after that, they will work in the cloud in the summer with many project activities. And the important thing is that your students will develop new challenges and they will develop projects that will help to have new digital tools for these patients. And finally, we have the second learning expedition that is going to be conducted in September in Split. This is the final gathering of all teachers, students, mentors. They will apply design thinking methodologies to refine, test, and advance the prototypes. And of course, the students will have the opportunity to present solutions during demo day to a panel of experts showcasing their innovative solution. In conclusions, we provide students with many skills, advanced education in order to be the healthcare professionals of tomorrow. Thank you so much.